mental health is a crucial aspect of overall well-being, and as many individuals lack access to mental health specialists and are unable to access assistance in relation to their mental health, it makes it even more critical to find new and innovative ways to improve mental health care. As mental health refers to emotional, psychological, and social well-being, disorders that can arise from this affect mood, thinking, and behavior. These can range from mild to severe and can have an impact on one's daily life. AI has the potential to revolutionize mental health diagnosis by providing a more accurate and efficient process. For example, AI algorithms can analyze data from multiple sources, such as electronic health records, genetic data, and social media activity, to identify patterns and predict mental health disorders. This can save time and resources and ultimately improve patient outcomes. However, AI is not a replacement for human expertise and empathy in mental health care, but ultimately, it can be a valuable tool in assisting mental health professionals in providing better care for their patients.
There are several advantages of using AI in mental health care. One of the most significant advantages is the ability to provide personalized treatment plans for each individual. AI can help improve the accuracy of diagnosis by analyzing large amounts of patient data to identify patterns and potential risk factors. This can lead to earlier detection of mental health conditions, enabling healthcare professionals to intervene before conditions worsen. Additionally, AI can improve access to mental health services by providing virtual counseling and support through chatbots and other digital tools, making it easier for patients to access help when they need it, leading to better mental health outcomes and a higher quality of life for those living with mental health concerns. Overall, the implementation of AI in mental health treatment has the potential to revolutionize the field and improve outcomes for patients.
Furthermore, AIs can act as a primary solution in treating mental health illness, as they have the ability to act more efficiently than humans in regards to diagnosis, as well as being a much more accessible service to patients. AIs can identify, analyze, and assess social media patterns of individuals and create hypotheses when necessary so that greater assistance can be provided in mental health diagnosis when paired with human psychiatrists and psychologists. When using AI for treatment, it must be developed carefully as AI has the potential to act just like a human, which poses many benefits for individuals who may not feel comfortable opening up about personal matters to a human. Those who may feel embarrassed can drop their guard and communicate with an AI as opposed to a human. This is just some of the many reasons in which artificial intelligence can assist humans in the treatment of mental health disorders in the real world.
In terms of problems and considerations, AI in mental health services pose risks, in particular patient privacy. Healthcare has been targeted by hackers for a while, and when individuals' most intimate details can be accessed, especially when linked to them through online logins, it poses detrimental effects. This can be mitigated through storing minimal identifiable data on a person, perhaps with a unique identifier only known by the patient and server, encrypting data on the server, and regularly deleting session transcripts after analysis. One ethical issue that arises from this topic is the potential for bias and discrimination. If AI algorithms are trained on data that's not representative of diverse populations, they may perpetuate and even amplify existing biases and disparities in mental health care. Finally, the article does not address the potential impact of relying too heavily on AI in mental health care, potentially replacing human interaction and empathy, which is essential to mental health care.
Therefore, AI could have enormous benefit for the treatment of mental health if it is implemented with the correct considerations in place. Many individuals do not have access to sufficient mental health treatment, and the use of AI could vastly increase the efficiency of care through analysis, personalized treatment, and improved access. Many solutions could be implemented, such as analyzing social media, chatbots, digital tools, and risk analysis. However, in its implementation, correct precautions should be put in place to minimize the risk of discrimination, misdiagnosis, and most importantly, privacy of patients' information. Overall, AI may have enormous benefit in the treatment of mental health.